Hi, I am Dr. Abhilasha Narayan, consultant gynaecologist at HCG Cancer Hospital. Cervical cancer is mainly caused by a sexually transmitted infection, that is HPV, which can be acquired through oral, vaginal or anal intercourse. But rarely it can also be transmitted by skin to skin contact, which is actually a asexual method of transmission. HPV vaccination should be taken as early as 9 years of age, and it is approved till 45 years of age. But the efficacy of the vaccination is better if you take it before becoming sexually active, that is early ages of 9 to 15 years. WHO says if you take it within 15 years of age, only 2 doses of vaccine is required, but if you are taking it beyond that, then you need to take 3 doses of vaccine. Coming to the efficacy of the vaccine, HPV vaccines are 99 to 100% effective in preventing persistent HPV infection and all precancerous condition which will lead to cervical cancer. And if you interpret and extrapolate this data, the efficacy in eliminating cervical cancer is very high. Cervical cancer is actually a sexually transmitted infection, a persistent sexually transmitted infection which leads to cervical cancer. Very rarely, if there is an inherent tendency in the body or a genetic tendency where you are not able to fight off the persistent HPV infection, then probably the risk of cervical cancer is high in such families. But nevertheless, the most 99% of the causes is sexually transmitted, so it is not hereditary, and very few remote cases we have seen a single family having 2-3 where we have found certain genetic mutations.